What's up, man?
What's going on? How's it going?
Great, great. How do I pronounce your name? Is it Faruq?
Yeah, Farouk. That's how you pronounce it.
Perfect, perfect. What's going on, man? How you doing? Thanks for hopping on a little earlier.
Yeah, no, it's okay. I'm doing pretty good. I just got classes in the afternoon, so I thought
Yeah,
so it's better for me anyways to hop on a little early. But yeah,
awesome, awesome. Let me just see. Yeah, I'm in the office here because I told you my ride isn't ready to go. That's fine. That's how it goes sometimes. All good.
that's all right.
Got to improvise a little bit. How was your day? What's going on? What year are you right now?
So I'm in second year now, just starting. So yeah, it's still 8 a.m. here or 7:30 in the morning because I'm all the way in the Gold Coast in Australia. So the
Damn.
time for this is like hectic. Like especially being away from family, it's like trying to balance like the time. So it's all
Where are you
right.
from originally? If you're on the Gold Coast and you're in Australia, where are you from originally?
I'm from Canada in Edmonton, Alberta. I don't know if you know where that is, but it's a smaller
No,
city.
I
It's
don't.
not as big, but it's all right. Yeah, because a lot of students out here, there's a lot of Canadians, like more than I expected, which is nice.
Yeah.
But no, it's a hectic city. It's
Oh, is it
beaches
really?
everywhere.
Wow. I mean, I know a lot of people from Canada studying in Australia, of a lot of people. I don't know too
Yeah.
many doing that, but I did notice that when I was signing people up through students of dentistry for the pre-dent mentor map. So I did notice that a little bit.
Oh,
But
really?
yeah, yeah. So what's going on, man? So you say you're a D2?
Yeah. So far, yeah.
So what's going on? How's dental school going? You liking it so far?
I love it. Honestly, I love I love the profession. It's nice. Like it's different. It's not what I expected, obviously.
Mm.
It's a little bit different, but I love the like everything about it, honestly. Like I'm more of like a work guy. Like I love to work. So
Yeah.
being like always crammed with things, like I just love to be under that pressure. So that's what makes me enjoy it the most, honestly.
Careful what you wish for.
Right now it's still DT, so it's like could get worse. We'll see how it goes. It's
Yeah.
a it's a little bit different though. The schooling out here, the D2 is more like a D1 in like an American and Canadian school.
Hmm.
So because our programs are 5 years here, so it's
Oh,
like you can go straight out of high school or you can do like partial studies. You don't need to write the DAT,
yeah.
which is nice. So it's a little
Oh,
bit different.
it
In
is
your
different.
D1, it's more like your sciences for like the students that came out of high school. And then your D2 is like you're working in your sim lab, you're working on your like cavity preps and stuff like that.
Yeah.
So it's different, but it's nice. I'm enjoying it.
And so mostly similar. When do you start with patients?
Next year, so third year.
And it's 4 years or 5 years? It's four, right?
No, 5 years.
It is five. Okay, okay. No, that makes sense now. So 5 years, you're still in SimLab right now, and then you got 3 years with patients. It's plenty of time.
Yeah. So yeah, third year you're just seeing like I think it's 2 days a week with patients,
Mm.
and then fourth year it's like 3 to 4 days, and then fifth year it's like 5 days a week and just
Yeah,
placement. So there's like no exams or anything. It's just like you're working in a clinic outside of uni, and
yeah.
you're just so it's like it's nice a lot.
That is. Did you have to go to college first, or did you go right from high school?
I went to like university first, and then I came here. But there is some students that are straight out of high school, so
Wow.
it's yeah. So it's I don't know. There's pros and cons to that though, in my opinion.
Yeah.
Like just
Tell
at a
them
mature,
maturity.
yeah, yeah, you could tell. But I feel like as we go through the program, like you're kind of forced to be responsible, forced to be mature, especially when you're
Mm.
like seeing like you'll only be 21 when you're seeing patients, right? So,
Yeah, yeah. No, it's a big difference. I noticed because I took a gap year in between college and dental school, and it did seem to be that there was a difference. Not everyone, in fact, most people, everyone's like generally along the same cut, but some people who were, I would say there's like an immature competitiveness in the class. I found them basically solely coming from people who just went from high school to college to dental school, yada yada, had no experience outside of school. And most people that went right through were fine. I'm just saying if there was someone that had that immature competitiveness, generally I felt that I observed that they were just straight through, no gap years, no nothing.
yeah, that's the same thing here as well. Very
Interesting, right?
similar.
Isn't that interesting how it works?
See, especially with the ones like the students that come straight out of high school, it's a little bit like they're still in that like grind to like, okay, yeah, I gotta be like the best in the class. I gotta push it. And like It's kind of like putting people down to go up, you know? That's the, it's like, I don't
I
know.
never like that. You don't need to put others down for you to get
No.
better. My favorite analogy is like, you don't need to put someone else's candle out to make your candle seem brighter.
Yeah.
Just be a
Exactly.
bigger candle. Be a bigger candle. Or like Gary Vaynerchuk says, you don't need to destroy someone else's building to make your building seem taller. Just build a bigger building. I think
Yeah.
that's probably a better analogy. But it's so true, man. It's a team sport, right? Like dentistry, you need to work with other. Although I'm getting a lot of comments on TikTok, and I saw some on Facebook as well that some people are like, they're like, "Oh, I'm a general dentist. I just do everything. I don't refer anything out." And it's like that is not what I don't know. Hey, their patients need to evaluate them for that, right? But the more eyes you get on you to evaluate a situation, a diagnosis, a treatment plan, I think the better. Sometimes it could get a little fuzzy, it could get a little confusing, but the more specialists you have something review, eventually it's going to be like, yeah, three all said this, and one said this. So probably this is the most appropriate way to go. Just in general, like, right? There's definitely outliers where that doesn't make sense, but just for example.
Yeah. No, I was thinking that too. Like for me, I'm in the point where it's like, do I specialize? Do I stay general? But then it's
Mm,
like now dentistry is like moving towards like the general dentists are pretty much doing like everything. And it's like, is it worth it to specialize? Like at this point in like as a D2 right now, it's like, is it worth it? Just because like I feel like people are referring less. So is that gonna make me like make less, me see less patients? Does that make sense? Or
Makes complete sense. And there is a certain trend in that direction. But let's look at the root cause of that. Because in general, now I don't know Australia. I don't know Canada. I don't know Australia. I don't know how the dental industry and area, is going in those areas. But in the United States, it's becoming more and more owned by insurance. Healthcare is owned by insurance, and it's not going in a great direction. For dental insurances in the United States, for example, the premium or whatever the maximum of that time was about $1,500 more or less, right? $1,000 to $1,500. Like 90% of insurances were that 1970s, okay? And the way they calculated that was 1,500 would cover people getting all their teeth removed and complete dentures, top and bottom put in. That's like history how in dental insurance is made that. Today, in today's day and age, 2026, what are the insurance maximums for patients? 1,500 to 2,000 a year. So it's only gone up roughly $500, okay, over more than 50 years. That's first of all, that's unacceptable. But now, what happens with that, right? Because all these insurance plans come out, they get a hold of all these patient populations, and essentially, they're not increasing their reimbursement. Now, that's just the annual maximum, right? But also reimbursement for treatment plans. Someone just on TikTok comment the other day. She was reviewing just a couple of years ago as their office went from written charts to digital charts, and a receipt came up, like a reimbursement came up from Delta Dental in 1999, and she said that the reimbursement in the 2020s was less than for a crown in 1999 from Delta Dental. Okay, so now let's see how the trend goes, right? So your question is it even worth it to specialize? This is great. Let's really dive into the topic while we have time. Is it even worth it to specialize when general dentists are doing more specialty level procedures nowadays, right? Okay, so that's the question. So what we look at is the insurance companies are not increasing, in fact, they're decreasing reimbursements for the same treatment, right?
yeah,
So as a general dentist, right? Because for a patient to get to a specialist, most times, 95% or more of the time, they need to go through a general dentist first before they go to a specialist, right? The general dentist under the guise of preventative care, fillings, crowns, like root canals, specialist procedure, sure. But like to save teeth, most of this preventative care is being reimbursed less and less. What's happening to taxes? What's happening to inflation? What's happening to rent? What's happening to the cost of, what you pay your staff, your team in order to
yeah,
keep your office open? All the overhead is only going up, 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 like astronomically, especially within like the last 10 years. 15 years. So as everything, all the costs of every tuition only going up exponentially, right? But the reimbursement for literally everything in general dentistry is going down. What does a general dentist have to do just to keep their doors open, to feed their family? They need to start doing either taking less insurances, which can be hard depending on the location, the demographic of patients you treat. If everyone's coming to your office for the last 25 years because you take their insurance, it's going to be a pretty difficult and challenging switch if you just ditch all those insurances. It would have to be a slow, steady. All right. So let's fast forward. You have to start doing specialty level work. All dentists that I know, generally, especially in my area of Long Island, New York, all the younger dentists that are in private practice, own their own practice, most of them are doing specialty level work, whether it's root canals and referring surgical cases out, or they're doing clear aligners or Invisalign, referring out root canals and surgery, or they're doing implants, they're doing all NXs, they're doing the implant and the crown, and they're referring very few. They're referring out people on sedation or very hard behavioral patients, right? So to answer your question, is it worth it to specialize? Well, I think for patient care hasn't changed. Better care, better treatment for patients has not changed, but the cost of everything has. So the trend is going in this direction. Is it better patient care? I don't have the answer to that. The specialists are always more adequately trained in complications. Always, right? So better patient care, you may look at it and say, I think it still is better in the specialist's hands. Now, a general dentist, instead of doing it, you could hire a specialist to come in-house to do it. You see what I'm saying?
Yeah.
Saying that I need to do all of this, the clear aligners, the Invisalign, the braces, the root canals, the surgery, the wisdom teeth, the implants, being a jack of all trades, are you really the best at doing all of those things? Or is that the best thing for that patient? Probably not. Probably not. I would wager probably not. All right. I know this is a long-winded answer, but I just want to give you some historical context in order to kind of understand, well, how did we get to this point and where is it going in the future?
Yeah, because like for me, like I watched, like right now I'm working a job as a DA and I'm assisting both a periodontist and an endodontist. And like honestly, like you can see the level of their work versus a general dentist's work. Like there's a big gap between them. Like, and even the perio, like watching him place implants versus a general dentist is like different. Like the way they just, like, for example, the way he opens his flaps and the sutures and everything is just like a lot better. So, but because I was talking to him and he was telling me you should go into perio, like, but then I started thinking, like, is it worth it to do those extra few years of schooling and all the extra money on top? Like, you're already paying so much for your degree, like, especially, so it's like, that's where I'm on the verge at the moment. It's more like the money, like, is it worth it because at the end of the day, that's what it comes down to for me, at least, like, is it to put that money into the schooling, or should I just put that money into a course and just start right away while I'm working? You know what I mean? Like, do you think those courses are those like implant courses that they do for CE, are they worth it, or stuff like that? You know what I mean?
How many years of implant focused training did the periodontist do that you work for?
Honestly, he became a oral surgeon in his home country, and then he came to Australia and they didn't accept his oral surgery, so he went to become a periodontist because he can do a lot of the similar treatments. Sure. Now, like, he's doing all that kind of work. Like literally yesterday I was working with him and we did like a alveoplasty. Like, it was my first time seeing that. Like, it was just like trimming down the bone and stuff. It was actually very cool. But like, just like surgeries like that, like I love it, but it's like, is it worth it? I don't know. That's my biggest issue. Just like,
well, let's think, because the question was those implant CE courses and such, surgical courses CE. But say, how many years is a periodontics residency in Australia?
I think it's 2 or 3 years. I think. But the thing is, they won't let you be going to here to specialize in Australia. You have to practice as a general dentist for 2 years, and then you can go to specialty. So they want you to get a feel for the profession before you specialize.
I love that. I think I really think that's excellent, honestly, to be completely honest with you. In the United States, it's 3 years. How long are those surgical or implant CE courses?
Maybe a month or two. I think some of them are like a year, but it depends.
If you played basketball for 1 year and I played basketball for 3, same height, same agility, jump just as high, just as fast, who's going to win that game?
Yeah, no, that's true. So
in a way, it's different. Sure. You have anomalies. Maybe someone is just born 7 feet tall. Yeah, they do a weekend course, and all right, they're dunking the basketball. Hey, look, like, there's always anomalies. There's always outliers. But just in general, in playing basketball, is different from patient care. Patient care is a little bit more important to me. I don't know. So I went the full route. I am biased, obviously. I went the oral surgeon route, and I get referred people all day where the general dentist is doing the easy stuff, and then all I get is the hard stuff. And they're referring it over under the guise that, oh well, he gets the specialist reimbursement. I just was with a general dentist on Sunday at a buddy's birthday party, and we found out that we're getting the same reimbursement from Medicaid, the same surgical extraction reimbursement. So, no, not necessarily getting reimbursed better as a specialist, which I didn't know that either. So we compared what reimbursements we're getting. That's Medicaid. So
Yeah.
just very interesting. I think a lot of people, that's why I like social media. And I like that you're getting into social media too. I really appreciate that. We got to talk about these things because everyone just loves to assume like he's an oral surgeon or he's a periodontist. They're getting specialist
Yeah.
reimbursement. And then you find out, you look under the hood, you look behind the curtain, and it's the same thing. This is where it's getting frightening because these insurance companies are getting away with so much. It's manipulation, it's
Yeah.
abuse.
No,
And you know
100%.
what? Like, it's ruining the career path, it's ruining the ROI. You have general dentists thinking that they could just place the same implant by taking a weekend course when maybe sometimes that'll be true. The most of the time, that is not going to be true. Um,
100%.
and now that's changing patient care. Patient trust is literally at an all-time low now in 2026, 2025, 2026. How are we going to get that back? How are we going to get patients trust again? So look, you're early on, man. You're a D2. I'm throwing a lot of info at you. I know.
Yeah,
I know.
no, this is good though. That's why I kind of started this social media to learn to hear from people who actually went through it, like where they made their decisions, how they made their decisions, like and like how things work. That's the main goal of this social media. So it's awesome. Man.
Yeah. So what else? What else you want to touch on? Let's get into it while we got a couple minutes here.
Let's see. Maybe we could talk about like Australia and how students can, because my goal is also to like help pre-dental students know that like what dental school is like and different pathways to go rather than like, because for me like coming to Australia, yeah, it's a lot of people like they have their opinions on it. I think like, oh, you're leaving to get an easier degree or something like that,
What do you
but I
think
don't
about
believe
that?
that people on social media.
What do you think about that, though? Did you leave to get? I mean, you already did college. You could have gone
Yeah,
to dental school in Canada, but you didn't want it. You could have gone to dental school in the United States, but you didn't want it. So why did you go to Australia?
I went to Australia because me initially in my first year of undergrad, I applied to, I've heard about like this program to go to Australia, this and that. And I applied and I didn't get in my first time. So then I thought, okay, that's like my test trial, like my trial run to see like if I'm smart enough. And then I didn't get in. So I was like, okay, well, maybe I'm not smart enough. So
Hmm.
then I applied to a chiropractic school in the States. And because I applied at the same time. And then I was like, you know what? I'm going to do this. I went there and I enjoyed it. But then I realized like this is like not really for me. So in the meantime, I ran and applied again to Australia because I didn't rate my dad because you don't have to rate your dad to get here.
Hmm.
And then as I was there, I did like 9 months, and then I got an offer to come here. So I was like, oh, I'm taking it. So I packed my things up and I came to Australia. So
Hmm.
it's like, yeah, because it was a little bit of that self doubt, like once I didn't get in the first time, but then I was like, I silently reapplied, and then it got in. So it was good.
Yeah. That's and you're liking it so far. You're really enjoying it. So
Yeah, I'm enjoying it.
you made the right decision. The one thing that I'm just a little skeptical a bit, I got to be honest, is when a dental school for dentistry doesn't take the dental admissions test. You know what I
They
mean?
take a different exam. It's called the UCAT. I don't know if you ever heard of it. It's like a it's like it tests like for example like verbal reasoning, like your decision making, like situational judgment, stuff like that. It's
Hmm.
like a really hard exam. Like yeah, it's different because they use that for med here and they use that for dental. And I think the UK also uses like a different version of it as well for med and dental. I don't know
Yeah.
if you've ever,
No, I
but
haven't. I haven't heard of that. But at least you are taking some admissions test then.
oh yeah, and they do
Okay.
like the interview and everything as well. So like
Okay.
there is certain universities here that like University of Sydney, University of Melbourne,
Yeah.
they take like the DAT. Then some, yeah, some take UCAT, some take that. So
So that's pretty good because in the United States, we're seeing dental schools now, some of them not taking DATs.
yeah, I seen that. I was like, it's
I
weird.
mean, there's just a number of weird things going on because now I mean, apparently, according to ChatGPT or whichever one it was, ChatGPT, that the dental industry, quote unquote, the dental area in the United States, it's because I've been told we're in a contraction phase where like corporations are buying up a number of dental practices, and then what they do is they weed out, they trim the fat, they weed out all the least producing ones, and then just go all in and maximize the highest producing or highest potentially producing ones, right? So that is a consolidation because now they consolidate into just what matters, right? Now jobs get left out because there was a dentist in that office. They don't have a job anymore. There was a dentist in that office. They're out of work now too. They had to retire, whatever it may be, right? And so ChatGPT is saying that it's actually not contracting the number of jobs, and it's like even, although I don't know, then if you look at simple math, it seems to be contracting. Now why is that important? Because there was like Georgetown Dental School, there was I think Robert Wood or some dental school in New Jersey in the 90s to 2000s. In the 90s to 2000s there were certain dental schools that dropped off. Now since 2020 there have been about 7 dental schools that have opened since then. Okay, so it's but like it seems to be in a consolidation period and has been for roughly 10 years. Maybe consolidate or like a decreasing job.
Yeah.
So what's going on here? And now some of those dental schools, Yeshiva that starts this year, 2026, and I don't know about California North State, but I know High Point University Dental School, Workman Dental School has they don't take the DAT. And Yeshiva, I'm pretty sure, doesn't take the DAT. Yeshiva is only 3 years, and it's opening up in Manhattan, New York, in a state that's already has the most or second most number of dental schools in the country. So why there's a lot of things that kind of conflict and contradict the patterns here when we actually should be decreasing the number of schools that are open, but it is a money grab because students will pay even though they're getting less clinical training.
Yeah.
I got a lot of questions, man. I obviously
Yeah.
I know I'm throwing a lot at you. In Australia, it's probably different.
Yeah, no, it is the same. Like even for Canada, it's a bit different. Like we don't accept a lot. Like a lot of the states, like the dental schools in the states, aren't accredited for to come back and work in Canada. So I think you guys have like almost 80, right? Like 77 or something like that.
77, I think.
Yeah,
Yeah.
and like,
So,
I think there's only like under 20 that are actually accredited for that. If you go to as a Canadian student, you can come back and work in Canada. And same thing with Australia. There's like maybe 10 that you can come to Australia, and then in Canada I think we have like under 10 as well. Like
under
the
10.
States, I know there's a lot more, like a lot of dental schools, and like even are you still allowed, like is there any extra training you have to do for some of these like private ones that are like you said, like the 3-year program and stuff?
No, no extra training.
So no, just 3 years. And
Yeah, there's one in California that's 3 years. Yeshiva is going to be 3 years now. You know what I mean? This is a couple conflict. Opening up a dental school in one of the states with the most dental schools, making it 3 years. You don't take a DAT. I got to double check that. Someone had told me that they don't take the DAT, but what are we doing here? This is. I know what's going on. It's Workman School is owned by. I mean, it was opened by this guy Workman is the head of. I think it's Heartland DSO. They're just, and he said it. They're basically just. He revealed that on a podcast. They're just trying to pump out students to fill their DSO offices, and it's textbook conflict of interest, and yet the ADA is just looking the other way at all of it. I don't know, man.
yeah, that's
What happened to ethics? Anyway, let's change the topic. I'm sorry about that. Let's go do another one.
Okay, let's see.
So, you're considering specialty. You don't know it. You're on the fence. Look, what I want you to do, I'm not saying you have to specialize. What I do want you to do is get as much exposure to those specialties as possible. You're seeing perio. You're seeing endo. You're seeing general. I want you to see, what about peds? Have you seen a peds yet?
No, I haven't. I don't know. Like honestly, working with the general dentist, like I think I work pretty good with like kids and everything. Like that's in general, but like I know peds is different. Like they're like the screaming kids, the kids that can't handle the dentist. Like it's like I know one of my friends. They just graduated last year and they got into peds in the States. I don't know exactly where he got in, but he's doing a pediatric specialty in the States now from Australia.
Nice.
So, yeah, he said he loves it. So yeah,
He's
it's a lot of extra like the best thing to do while you're in dental school, like to specialize. Like other than shadowing, knowing what you like I know a lot of people, they do like research and stuff. Like should I be doing research as well, you think? Or
for peds or for any specialty in general?
like any specialty? Yeah.
research is good, but it's not like an admissions test. It's not like an application. It's like, it will help you get or gain a relationship with the person, like the principal investigator, the person you're doing the research with, and they might write a letter of recommendation for you if they like you, if you do good work, right? If you're committed, you show
Yeah.
dedication to it. So that could be beneficial there, right? You get a mentor maybe. I did research in dental school with a periodontist who was a good mentor of mine, good friend of mine, I would call him. He was great. I felt he was a good leader, a good teacher, a good person. He wrote a letter of recommendation for me, but I just enjoyed learning from him about more than implants and like implant
Yes.
services, just life. He was that kind of person. So do you need to
My
do
perio,
research? But pick who you're doing research with.
yeah, that's true. Even like you're saying, like my perio, like I see him as my mentor as well. Like he's a wizard. Like his hand skills are just like, even when he's popping out, like he pops out a lot of like impacted wisdom teeth and stuff, and
Hmm.
like the way he does it, just like they just flick out, and then you see like a general dentist, like it's like you see the level it's of skill. It's just, I don't know. That's what kind of pushing me to specialize, just because like patients love that, like the periodontist, like just because they don't, they said like it's just so smooth, the way he works is so smooth, like
Hmm.
very good with patients. I don't know, I he teaches me a lot, like he's very good.
He sounds like a mentor to me. He sounds like a good guy.
Yeah, he's very good. He's a
I
good
think you'd
mentor.
stick with him. And you know what? Look, like say you decide to go perio or you don't, you got to stick with him because that sounds like a teacher for life, a mentor for life. And
Yeah,
if you really like the way he does things, you could kind of live on in those footsteps kind of thing. You could learn from him and take that patient rapport that he develops. You said that the patients love it. That's someone you want to continue learning from and maybe emulate when you do surgery or even if you're doing another specialty or general dentistry. I think it's great.
yeah, no. And he told me he's like just work with me throughout your degree. He's like, once you get to like fourth year, he's like, come to me and then we can talk about like specializing and try to connect you with some of the periodontists and stuff, like in these like departments in the universities and stuff. I'm like, okay.
Yeah.
That'd
Yeah.
be nice.
Dude,
He's a
I
lot of
think
connections, so it's kind of like,
really. Do you know what country he did oral surgery in before he did perio in Australia?
I think it was Pakistan. I think
Hmm.
I think so. I'm not 100% sure.
That sounds awesome, man. That really
Yeah.
sounds great. Yeah, you stick with him,
Yeah.
you see about it. But you see what I mean about the whole you see the difference. You literally said it, like the difference between the wisdom teeth, him, oral surgery trained, right? Periodontist now doing wisdom teeth versus a general dentist doing wisdom tooth. It's think about the patient. You as a patient, who you're going to go to? You're going to go to the specialist who's been training and does that procedure every single day for years. Versus, I don't know how often like the general dentist you see does wisdom teeth, for example.
Yeah. No, they do quite a bit, but more like as soon as it's impacted, they don't, like the ones I work for, they don't touch it. I feel
Mm.
like dentists here in Australia are a little bit different. They're not as they're not much like risk takers. Like they don't take, like I feel like in the States and Canada, like if there's like a lot of like slight complications gonna happen, like that might happen, they'll be like,
Mm.
ah, we'll be fine, and they'll just go into it. Here they're very like conscious of what they're doing before they do it. So like they
Mm.
refer so much out here. Like even molar root canals, like none of the dentists really do that. They just refer them all. The only, unless it's like an anterior teeth, then they'll do the root canal. But other than that, they'll just refer it. Same thing with wisdoms. As soon as it's like a slight like a slight impaction, then just refer. Like all their stuff gets referred. But it's a lot different than Canada and the States, is what I realized.
Mm. Interesting. It also comes down to provider. I know a lot of providers, yeah, doing a lot. I also know a lot of providers that are like, no, I don't do any endo. I refer all endo out. Yeah, it's an interesting thing. It depends. People do what they want to do, and I think that's great. If you're a GP dentist and you want to be so like great with, I know Dr. Amir. He's a Canadian. You know Dr. Amir? What is it? The Real Tooth something. He's Canadian. He's Canadian, Canada dude. I forget his handle though. It's like the Real Tooth Doctor or something 2.0. I think his account got deleted. But yeah, he's a GP. He's a general dentist in Canada, and he does wisdom teeth. Like that's his main thing. He drives around to like 7 offices a week. But
Uh,
he's a guy to look into, man. He's a good guy. I like
yeah.
him a lot.
Yeah, those, I don't know, like I see like a lot of dentists, like if 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 you're a general dentist and you're good at one thing, like I think you could also go down that path. Like, yeah, do all the preventative stuff, but also, for example, if you like pulling out wisdom teeth, then also
Mm.
just focus on that, get some training on that, and focus on that while being a general dentist. Like, I think that's the route that like I'm leading towards, but I'm not sure yet. Because I love
Okay.
the oral surgery part of dentistry. Like I enjoy it.
What
like
does your
watching.
mentor think as a periodontist? What would he think about you doing GP versus going and specializing and doing the same procedures he does?
He told me based off like the way, because I ask him, like I'm flooding him with questions all the time, just like little things, like constantly asking him questions just to learn, right, as much as I can.
Good.
He's like, he's like, keep learning. He's like, if there's any advice I'd give you is keep learning. He's like, constantly keep studying. He's like, focus on your studying. He's like, he's like, if you do your dental degree, go do some more research. Go specialize. And if you can do more and more and more, he told, because now he has like two PhDs and he has like a master's. And he has a bunch of degrees. Like, and he was telling me,
Mm,
he's like, keep learning. He's like, and you'll just get better and better and better. And he's not one of those guys that's like all about the money. He's more like strictly patient care. Like,
mm,
so that's why I think he also succeeds a lot, because his main focus isn't just the money, it's more patient care. And with that comes
mm.
success. That's what I think.
I love
So,
that. I really respect that. I do.
yeah.
Not being all about the money. I mean, obviously, things need to be appropriately worth. You need to have an ROI that's appropriately placed. Like, unlike the analogy I gave, where the dental maximum per year is basically the same as the 1970s. If you track inflation, it would be between $6,000 and $8,000 now for every single patient. That money's got to go to the CEO of Delta Dental, though, not anyone else. I think that's so great. I really think that's great. It's a good idea to keep specializing, but I don't know if you need that many PhDs. I mean, maybe you're just married. You love learning, which is great. We always got to keep learning. That's our career, right? But you want to make sure. I mean, it also depends on what your priorities do. I'm sure you want to have a family and kids
Yeah,
someday too.
that's another reason that I'm like a little bit hesitant, because it's like right now I'm 22, turning 23.
Mhm.
So it's like, do I go specialize? Like, because by the time I'm done, I'll be 26. And then like, if I have to specialize, I'll be what, 28, 29, maybe 30. It's like, when do I start a family? While I'm in uni, you know? I'm a big family guy, so it's like, you kind of have to weigh
Yeah.
out your odds. Like, it's just hard. It's hard to think about it while you're in dental school, like, because you're already dealing with so much, and then it's like, then you have these thoughts that just you'll be laying in bed thinking, "What am I doing? Should I do this? Should I do that?" And then you start seeing like stuff on like online, and you're like, "Ugh," your
Yeah.
whole mind is like all over the place. It's just like that's where it kind of gets to me.
Well, let's take a step back. You were saying 20, say 26, and then you're saying like maybe 29 by the time you finish, especially. I didn't finish oral surgery residency till I was 31. And that's not late, believe it or not. I took a gap
Yeah.
year. The earliest I could have finished was at 30 years old. Most people finish that between like 30, 36, I would say. One of the chief residents a year above me graduated at 48 years old. 48 years old, graduating from oral surgery residency. Now he's finally starting working, starting his life. So now, obviously, the cards in the deck aren't for him at that time, but he's living his life now. Everything worked out for him, and he's fine. He's happy. He's living the dream. So I wouldn't put a timeline just based off age, but I think you're doing the right thing. You said family man. You're considering all these things. It's like a collage. As you put it together, that's really important to see how the pieces come together like that. The other thing I would say is you're right where you need to be. You're asking all the right questions, and you're in the same boat as like most dental students in the United States, in Australia, in Canada. Luckily, you have another 3 years. You are going to know what you want to do, what you need to do, what you're most interested in by the time you're ready to graduate or you're ready to apply to the next thing, which is another 2 years. You still have another 2 years before you're at that point, right? Because you apply the year before you graduate. Dude, you're going to be just fine, man. You're gonna be fine. I don't put unnecessary stress on yourself. I like your periodontist mentor. Keep learning, keep focusing, get more exposure to everything. You're gonna be
Yeah.
fine. You're gonna be fine, man.
Hopefully. I'm excited, but also, it is a lot to think about. But I'm like one of those guys where I like to plan things. Like, I'm like, okay, at this time this is gonna happen. At this time this is gonna happen. I know it's like it's a reach, but I try to aim for those. Like, I set the goal at like at a time, and then I want to do that by that time. Like,
So what are your favorite two specialties then? Let's put it this way then.
honestly, I really like perio. Like, I honestly really enjoy it, and I like the oral surgery stuff from perio. But like, cause me, I don't see myself being an OMFS. I don't think I'm like that prestige yet. Maybe I'm still early on in my dental degree, but
Give it
I
time.
don't know.
Give
I
it
think
time.
you need to be like top of the line, like best. But I don't know. I don't know if I'm there yet.
That's fine.
But
So let's say oral surgery and perio. And are those two competitive specs? I know orthodontics is also very competitive,
yeah,
right? But let's say oral surgery and perio, very competitive, right?
yeah.
Okay. So do you have to take extra exams for oral surgery, perio, or say orthodontics?
I'm actually not too sure. I haven't really looked too much into actually applying because I recently just started talking to the periodontist about like specializing. He asked me like maybe 2 weeks ago. He's like, would you ever consider specializing into perio?" And then I didn't even think about it until then. I was like, you know what? Like maybe I would. Like I would
Hmm.
enjoy this. Then I thought about it, and I was like, yeah, maybe this would be good. Like so,
So it's
I
early.
had a
Yeah.
lot of like learning about it yet, like the application process. Because me, I wouldn't do my specialty here. I would either do it in like the States or Canada.
Got it. Got it. Okay. So states or Canada. So you're going to need to look at international requirements to transfer that over. You got to
Yeah,
look into it's early. It's fine. You got plenty of time for all these things. You got to look into if there are other exams. Like, for example, in the United States, you need to take the CBSE for oral surgery or the GRE for, I think it's the GRE, GMAT. No, I think it's the GRE for orthodontics. So here's what I'm getting to is early dental students early on D1, D2, for even D3 is still technically early for you over there in Australia because you still have another 2 years after that. That's like a D2 here in the States, more or less, right? Different, I know, but for timelines, yes. And why is that important? Because if you shoot for, say, ortho, oral surgery, perio, and you're planning to take those extra exams, you're really focusing on getting good grades, you're good in your rankings, you're learning a lot in clinic, learning, just like your mentor said. And then say at the end, you're like, you know what? I don't want to do it. Is that gonna hurt you or help you?
it's going to benefit you for sure.
It's gonna benefit you. But what if you aim for, say, general dentistry, and then at the last minute you switch because you never knew, you never really committed, you never went, and now all of a sudden, last minute, you got a year left, you're gonna commit, you can try. Is that gonna hurt you or help you? Kind of like the first year you didn't know, so you didn't study
Yeah,
for every single exam, just some of them. Is that
yeah.
gonna hurt you or help you?
No, that'll actually help. That's going to hurt you if you're doing the general dentistry route, though. No, that's true. I never thought about it like that.
So early, I mean, it's simple, right? So early on, you don't know. So aim high. And then you could always finish low. But you can't aim low and finish high. That's a steep slope to try and ramp up to at the end. That's only going to shoot yourself in the foot.
Yeah, no, I realized that. Like even like within like clinic itself, like we're still just starting in sim lab, but like a lot of people they don't realize what was going on because like some of these people they just did shadowing and like they get their shadow hours, but like realistically, I feel like when you're shadowing, you're not learning nothing. Like at least for me, when I was shadowing, I was always like worried like, oh, am I too close? Like I was like, okay, maybe should I just step back here? Like I want to see, but like I don't want to be in the way. But I was like I wasn't really learning much, but then once I started to assist, I'm like, okay, this is awesome.
Yeah.
It's like way different, which is I
It's
feel
hard.
like what more even pre-dents should do. Like even if you just assist for like a day, just kind of see what it actually is like. Like
Yeah.
it's different than shadowing. I don't know. That's what I think. I feel like
I
shadowing
totally
doesn't help me. Didn't help me much.
Right, right. You really need someone like a mentor, like the periodontist, to like. If you're just shadowing, they really kind of need to take a step aside and point out different things. This is the periosteum, this is a full thickness mucoperiosteal flat. You know what I mean? You need them to stop and kind of point out things and make sure you could get over and see it, which that's going to be dependent on who you're shadowing. But as an assistant, you're in there, you're in
Yeah,
it. You got gloves on, you're getting bloody. Yeah, that's I agree.
yeah. No, it's a big difference. Even just like the learning, like assisting someone like that perio, like he's teaching me as he goes. He'll like
Mm.
this and be like, "You see that?" And then I'll be like don't even know what he's looking at, and then he'll point with his probe, and I'm like, oh, okay. And then he'll explain like what it is and what he's doing, and it's like it's nice because like I'm like getting ahead, and I'm like, okay, this is actually like I'm just loving it, honestly. Yeah,
That's good stuff, man. That's a true mentor, man. You stick
yeah,
with him. You do whatever he says. That's what I did with my mentor, who's an oral surgeon, would do the exact same thing that you said, and it was a big part of why I went that direction. I listened to everything he said, honestly.
because I was thinking like even I don't know, is it good to just stick with the one mentor, or should I look? Because some people were telling me like look within the university as well, but like
Oh
how
yeah,
do you approach those? those big like head of the departments in certain things. Like I don't know, I feel like a little bit shy to like just go walk into his office, be like, hey, like how's it going? You know, I
Sure.
don't know.
No, that's a great question. That's tough. See who kind of takes a step towards you and like gets and like gives you more of their time. Everyone's busy. Everyone in the dental school is busy. You know that, right? But see who kind of takes you under their wing a little bit here and there. Does exactly what your mentor does, the periodontist. Someone that does that, that's you got to wait for little signs. You know what I mean? Someone who calls you
Yeah,
by your first name, someone who makes a little more eye contact, not in a weird way, not a weird eye
yeah,
contact way, like genuinely wants to kind of engage with you and teach you something or ask you how your day was. That's someone, it's little mannerisms like that that I would say that's someone who's interested in teaching you, interested in your future. That's something important, you know?
yeah. Because like for example, like the professors that teach us, like for example, like the oral surgery stuff and that kind of stuff, like that's more in like a 2 years we learn that stuff. So
Yeah.
it's like these guys like they don't even know who I am, you know, they're in their just big office on the top floor, you know. So it's like I don't know. Is it weird to like how can I go into their room and be like, hey, like I want to learn from you, you know? Or is it like do I wait until I'm like higher up in my degree and then I talk to them like that, you know? I don't know. It's just hard to find a mentor like at the uni for me. That's what I
Sure.
realized.
Start with talking to the older level dental students because they've done it, right? Someone who has done it, ask them. Ask they might be able to introduce you to someone in the department just to go in and shadow. Hey, by any chance, I see that you matched into oral surgery next year. Or like, hey, like find someone who's in that doing it etc. Right? Go to them. See how they would recommend do it. Maybe they can introduce it. Maybe you could come in and work on a case. You could assist them on a case that they're doing. Maybe they'll introduce you to an oral surgery resident. Hey, this is a really nice guy or girl. Maybe they'll let you shadow or assist on a case sometime. Bingo, you got the in. It's going to be through
Yeah.
who someone you know. That's
Someone
what
I
you got to
know.
do.
Yeah. Actually. I know some guys in upper years that probably be willing to help out. That'd be nice.
Maybe they know someone. If they're not in the clinic, maybe they know someone who's friendly and going into the clinic, right? Someone who's done it a couple times that's not nervous. If it's their first, second, third time, they might be nervous themselves, and that could be a little friction. You know what I mean? Someone who's
Yeah.
like comfortable, who's laid back, relaxed, someone you know. Yeah, I think that's your key, man. Yep.
Yeah, that's a goal. I want to have like because I feel like there's pros and cons to having just one mentor, you know? Like if you have like multiple, you kind of take a little bit from each and you build yourself as like especially as a dental student, that's what you kind of need like because there's so much stuff going online that's like just kind of ruining what
Yeah.
dentistry is. Like I don't know, in my
Yep.
opinion, like they just some of the stuff like for example pulling in like or doing root canals for example like oh you shouldn't have dead tissue in your mouth and it's like I don't know if you've seen that.
I
A lot of
have
people.
in the Netflix documentary on root canal stuff and all the cancer and like there's a lot of fear out there. No, stick with the mentors. I think having multiple mentors in different areas is probably the best thing you can have, right? But don't neglect the mentors who have always been there for you. Don't do that. Don't just be like hopping, skipping, and jumping. I know a lot of people that do that. I met a girl at Columbia who, like, I met, this is a year ago, actually, a year ago next month. And I was just going out of my way, like DMing, call it whatever, going out of my way to help them or everything. And then I saw her at an event recently and it was like, hey, you remember me from last year? Yeah, thanks so much for the help. All right, see ya. And it's like, it's kind of like use like you're just using people. Don't use people.
Yeah.
If you're and then here's another thing. I know you do this because you're making content and it's genuine. I really like that. So I appreciate that you're doing that.
No, thank
Become
you.
a mentor too, right? And I know you're doing this, so I don't have to tell you twice. But people that are listening to this, don't just use people and like hop, skip, and jump. The same people do the same thing in relationships. I know you know what I'm talking about, right? To
Yeah.
just hop one boyfriend or girlfriend to the next, not cool. Don't be that person, but be a mentor too. Get mentored, get as many mentors as will help you, but be respectful to the mentors and then also become a mentor.
Yeah, you know, I realized that like a lot of students actually started to message me and ask questions. And it's like no disrespect to some of the people that are posting content, but I was one of those people messaging people and like it's like if you have like 1,000 followers, like if I'm messaging you or somebody's messaging you, you're gonna see it. Like I see every single person that messages me. I got maybe like over 100 messages, but I still read every single one and I reply if it's a question, you know. But a lot of people,
Yeah.
they just kind of disregard your message. Because like before I got into dental school, I was messaging people and stuff, and people would have like not that many followers, but it's like, I get it, you're busy, but to disregard somebody's message who's asking like a proper, genuine question about
Yeah.
like what dental school is, it's kind of frustrating, which is why I kind of started this account to like answer
To
these
do
kind of
that.
questions.
Yeah.
And I,
Um,
it's like,
I gotta say, I've been a little guilty. I've been a little guilty recently. I just been getting bombarded with messages. Honestly, the last year, because when I was graduating last year in April, May of 2025, it just my last run, my last couple of months of residency, and then after I tried to catch up a little bit, and then I was away for 2, 3 weeks, and then I was board studying from October through February of this year, and now I'm slowly starting to catch up. But no. I for years I've been on top of every message. I got to your message, but
yeah, that's good.
it it's no. So I completely agree with you, but I I will. I now I'm feeling guilty. I got to catch up with all my messages in the
No,
DM.
no,
And then you have TikTok, then you have Instagram, and then I have to catch up with the LinkedIn ones, and then there's comments on the podcast that I got to catch up with, and then Facebook Shorts. I'm behind like 12 months on those comments.
but how do
And
you, oh, sorry, what were you saying?
no, I was just saying like anyway, it's funny.
I was gonna say, like, how do you manage that? Like for example, me, as because I know you were still posting while you're doing like residency and all that. So like, how do you manage that? Like, especially me as a dental student. Okay, like I gotta study, I gotta do
Yep.
my classes, my labs. Then I'm also working a part-time job as a DA, and I want to hit
Yep.
the gym, and I want to do this content, and I want to focus on my health as well. And that's why I kind of put my account to keep me accountable with my fitness, because then it
Mhm.
helps me like post some fitness content, so I make sure I'm going to the gym, because I try to go to the gym every single day just so like reset. But it's like,
Yeah.
how do you manage that like with time? Because I think that's the hardest part about dental school. It's not the courses, not the material. It's more, how do you manage your time and all with when you're just getting tossed like everything at you at once. It's like you get comfortable with one thing and then you get thrown another thing at you and then you have to keep going. It's like, I don't know. How do you manage that?
Well, you get better. The easy answer is you get better. The hard answer is, I mean, we could really get into it, and then I got to get going on my rides here. But routine. You answered this. You answered your own question. You were saying I go to the gym every day for unwinding, de-stress and stuff. Well, it's the same thing in a different regard. If you really want to stay consistent with content, got to make it every day, or at least every weekday. Through residency. I would try to do it every weekday. It's routine. Just implement that into your routine. When do you go to the gym, in the morning or at night?
It depends. If I try to go like after work or after class at night, or sometimes if I have like nothing in the morning, I'll just go in the morning. So it's like
Great.
mostly.
Okay. Well, if you fit a certain block every day after you get out of school, you go to the gym, that becomes a part of your routine. And that's like your block. Maybe you make content in the morning then. Maybe you make content right after on your way to the gym. My little content thing was I would get out of work. I would be walking across the street from the hospital because I lived right across the street to minimize commute time. That's just wasted time, right? So my commute was literally a 5 to 10 minute walk. So when I got out of work, I would exit the hospital. I would just make a stupid little video like this, right? But I would try to talk to something that's applicable to other people, things you can relate to, things like you don't know about and you want to learn about, a thought, an idea, something that happened to me that day. That's it. That's it. I just talk about something unique to the experience, right? And then I was literally walking across the street I would walk across the street, get into my apartment complex. I wouldn't go up to the room yet. I would sit down in the lobby. I would I would edit all the ums and ahs, put captions on it, post it across the multiple platforms, and then I would go up. And then I would get in like 15, maybe 30 minutes later, tops. I would get into my apartment. Then I would go right down to the basement where the gym was. Routine, routine. Now, that answers that question. You need to really maximize your routine morning, afternoon, right? Because dental school is different, but it's like 8 to 6, maybe. Residency's worse. It's like
Yeah.
6 or 7 a.m. to 6 or 7 p.m. or later. And then you had a good point. Like things just keep adding onto your plate more and more. How do you handle that? Well, there's actually a Jim Rohn quote. You don't ask for less. You ask to become better, to match like that thing, because life just keeps throwing shit at you. Like
Yeah.
that's a fact, right? It's just going to keep going. You're going to graduate and you're going to think it's all done. Now I get to relax a little bit. You still don't get to relax. Let me break that to you. One of the things that I do, how do I manage more things? I use this app To Do. This is not like an endorsement, a sponsorship. This app right here. See that right there? To
Yeah.
Do. Okay. This, as you can see, this it's just a to-do list, a calendar. See, I got the podcast, everything on there. And I just go through that day to day and I just cross everything out. You could set things to repeat every day. You could set things to repeat every Monday, every fifth day of the month, every year. You could organize things into folders. It's literally just a to-do list, but it synchronizes across all the devices. And this is how you add something else onto the plate, add it into your to-do list, and just put in your calendar, knock it off. Okay.
Cool.
That's my biggest. I've been doing this since my literally D3 year of dental school. It's been
Oh,
like 7, 8. It's been like 7, 8 years. I still use this thing all day to the T.
no, that's good. I think like that's something that will help me a lot too. Just because like I don't know, sometimes I'm just like a little bit all over the place sometimes. It's just like you just had a long day and then you're like, okay, well, what I gotta do here? And you're like a zombie working sometimes. And you're like on the and it's just like, you know. But
I
no, that's
know. I
good.
know exactly what you mean. I'll tell you what, man. We'll have a part two. Let's plan out in a
Okay.
couple months, and we'll go through what worked, what didn't work, where you're at. Maybe it's next year. I don't know. Like it's
Yeah,
once we take more steps. You've like met an oral surgeon. You've done a little bit more that your periodontist mentor. Like say in a year, maybe that's more appropriate, right? Let's see the difference where you're at, how you got there, so people could learn from you. And I think you're passionate about it. You're passionate about giving back and teaching.
I appreciate that. Yeah, yeah. Well, that I'm down for that. It'll be good.
Let's do it, dude. I gotta hit the road, but I'm gonna send you the to do app or look it up. Let me know if you can't find it. I'll
Yeah,
send it to you. I want you to check out. Maybe this one doesn't work. Maybe you just use the reminders app in iPhone. Doesn't matter, but you need to find something that works for you. Because if you're a
yeah,
little like you said, zombie mode, I know exactly where you're at. You need something that gets structure back to the routine. You know.
yeah. Okay.
All right,
Well, look,
brother.
it was nice meeting you, man.
You too,
Take
man.
care.
You too, man. Keep it going. You're a good guy.
Thank you as well, man.
All right, man. Talk to you later. Good night.
Bye.